Hello, everyone. It's Dr. Amanda here, your plant-based lifestyle physician and health coach who is here to educate and empower you so you can make healthy decisions to live your most abundant life. So as you know, I have to do my disclaimer that even though I am a physician and I have physician guests, we are not giving you any type of medical advice, and it is not intended to treat, cure, or diagnose any specific illnesses. And if you have a specific question, please contact your own personal medical provider. All right, I have a special guest here with me today, Dr. Olabintan. Sorry, I was like, I blanked there for a moment. But she is here to talk with us about her practice and what she does. So please introduce yourself to the audience.
Hi, thank you so much, Dr. Amanda, for having me here. I am Dr. Olabintan. I am a family physician here in the city of Mansfield, Texas. And I'm also the founder of Living Spring Family Medical Center, where we help patients live long and well, because we believe that the quantity of life is just as important, or the quality of life is just as important as the quantity of life.
Yes, I love that. So for us that are not in the Texas area, can you tell us where exactly that may be relative to a major city?
So relative to Dallas, and I've gotten to know that Dallas is like big. It's really, really big. So I'm closer to Dallas than you would say Houston. So I'm 3 hours away from Houston, but about an hour, depending on where in Dallas you are. I'm anywhere from 20 minutes to an hour and a half or 2 hours from Dallas.
Okay. That sounds good. Sounds good. All right, because I was like, I have family in Texas, but I did not know where you were. So I was trying to figure out exactly where that was. So wonderful. So if you're in her area, please definitely check her out. But let's go through a few things here. So you said you're in family practice, right?
Yes.
And so can you tell us what type of illnesses do you see in patients that come in your practice?
So the major ones, especially the ones that patients don't even know they have, diabetes, high blood pressure, and high cholesterol. Those are major. Others are asthma, others are thyroid issues and things like that. But the major, high blood pressure, diabetes, and high cholesterol. Yes.
Yes. So unfortunately, those are the most common I see also. And it is unfortunate for some people, especially like you said, since they know they do not have those illnesses. So, you know that I talk a lot about plant-based nutrition, and I know that you talk some about that too. You posted a few things on your social media about how some patients were coming off of medications and things like that. So can you talk about why you think plant-based nutrition is important?
I'll be honest with you. I'm thankful for the privilege of being a physician, and that we were trained to practice is to prescribe medications. And I'm thankful that we live in that era where that's an option. But I've also seen the damage of medications. I've seen what medications can do, especially when lifestyle changes are not, done in conjunction with that. And so I believe that patients are able to do better if they're able to incorporate more plant-based, So I've pushed away from, you must do this, you should do this, because I know the benefits of it. I know that it helps promote longevity. I know that patients will feel better as they eat healthier. I know that, but sometimes I want to meet patients where they are and kind of pull them to where they should be. And so knowing that information and balancing that with trying to encourage the patients to get to that point is why. So I know what medications can do. I know the damage of it. I know the pluses of it, but if we can get it done the best way possible, which is through lifestyle changes and plant-based diets, why not?
Right. Yes. Do you find that when you actually mention this to your patients that there's like resistance and they like, no, I just want a pill. I don't want to do this.
So I've gotten comments like, Doc, you want me to eat bird food? That's with birds. Like when I say whole grains, legumes, and fruit, they're like, Doc, bird food? I said, wait, no. What I'm saying is I want you to use these as medicine. because sometimes they even come to me complaining, oh, I'm tired of taking this medicine. It makes me feel tired. It makes me feel this. Or doc, I'm trying to lose weight. I feel sluggish. I'm not able to sleep well. And I'm like, well, what can we change to get you to that point? So sometimes it's almost like a bargaining. We want this. These are things you got to do. So when I mention plant-based foods, they're like, oh, doc, no, this is the way I grew up too. This is how, my mom would throw it down in the kitchen and we eat this and we eat that, and oh, doc, like, and I've even had patients tell me, especially my older patients, like, it's almost like you don't want me to be like I almost feel bad, but I'm like, man, like I see you in your 70s. Like I asked them, what's important to you? Like, but they're like, well, playing with my grandkids. I said, I want you to be able to play with your grandkids. So to do that, you got to make changes now, and that includes your diet.
Yeah.
So it's meeting people where they are and understanding what the challenges are, and then helping them kind of go over it. Like, it's possible to go over those hurdles.
Right.
It's possible. So yeah.
Yes. So you say you see a lot of, well, not a lot, some resistance to that. And so what do you actually tell them that actually gets them over that hurdle? Like, so if you said they don't want to eat bird food, how would you respond to them eating bird food? What would you tell them it was like?
So I and sometimes it's common. We have fun with it. We laugh. And then I say to them, I say, if you had a fancy car, right? Would you wait for it to break down before you took it in for a checkup? And they'd be like, well, no, I'll make sure she's good, make sure oil's changing. I said, I'm glad you came to the doctor's office because we're trying to find things before they become an issue. Okay, so blood pressure is high, right? And I'm saying we got to do more fruits and veggies. Well, over time, if we don't do these things, engine could knock, right? You could have a heart attack, you could have a stroke. So you tell me, and then another one is this. I say, you sometimes you don't feel like wearing clothes, right?
Yeah.
You want to walk around butt naked, like it's just comfortable. But you subconsciously you think about the consequences that if you would walk out the house naked, you would be sent to a loony house. So already you made decisions, conscious efforts to do what you're supposed to, as inconvenient as it was. I level the ground. It's inconvenient. I agree. But there are already so many inconvenient things you're doing. And so knowing that this is important for you is another inconvenience you add to your repertoire, right? Because God forbid you had a stroke. I tell them, I said, those foods you want to eat, you will have no choice to eat it. So, I said, meet me halfway. I said, okay, so how can we change your diet just a little bit? Well, I guess I could cut down my salt. Oh, so you eat a lot of salt? Yeah, like salt, I put salt in everything. I put salt on my cucumbers. I put salt on my pineapple. I put salt. And I'm like, wow. Yeah. So pineapple, I'm like, why would you put salt on pineapple? Like it tastes nice just by itself. Cucumbers are nice, bland, and just, and so I talk to them about inconveniences that they're already doing. And I tell them, you are worth the inconvenience. You are so worth it. And so it's important for you to not see it as, okay, if you want to see it as an inconvenience, do it because it's good for you, or even pretend it's medicine. Oh, 4 to 5 servings of fruits and vegetables today. Have I taken my medicine? I say it's either that one, or at some point you'll be on other medicine. So, so that's the bird food conversation.
Yes. I like that when you say, have I taken my medicine? Because I haven't actually mentioned it like that, but I do tell them, like, do you want to do this or, a pill? Have you had any success with anyone, coming off their medicine and changing their lifestyle?
Oh my goodness. And, one of the things I've also, before I even go into that, I've learned is that patients, okay, the numbers are high, cholesterol is high. Well, I don't feel it. So doc, it's not, but as they make the changes and they eat healthier, they feel less, okay, I don't want to say less bloated because vegetables can make you bloated, but that's transitional, right? That's right. It's short term. But as they feel lighter, they feel better, they sleep better, they go to the bathroom better, they have more energy. I'm like, okay, so your numbers are better, but how do you feel? Like, doc, man, I feel better. I said, hold on to that. Hold on to that. Okay, hold on to that feeling. So I'm not just saying it just so that I can look at the chart and it's all pretty because your numbers are good. It's for your benefit. And so when you sell them on the fact that they will actually feel better, then it's worth it. So patients who have successfully, man, I had one. He was so upset with me because I labeled him diabetic. He made it seem like it was my fault. I said, like, you just meeting me for the first time. I had laughs. Are you telling me that? And I was like, oh yeah, you have high cholesterol too. And then your blood pressure is high. So yes, like he was so upset. He's like, I want you to take it off my chart. And I said, okay, that's fair. So he didn't want to take medicines. I practically begged him. I said, how about this? I'll give you half of what I think you should be on. Let's start there. But this is what you got to do. I said, Rita's Ice, there's lemonade sweet. I said, when you taste a natural lemon, it tastes bitter. When you taste a lemonade, you got to know that it's too much sugar. When you eat natural cranberries, which I did not too long ago because I love cranberries, and then I tasted the juice and the actual thing, I'm like, oh, I would never drink cranberry juice again. Because cranberries are nasty. They're like tart. Okay, take cranberries. They're good for you. Okay, but they are very tart. And so I said, go ahead, let's try this, cut this out. He came back to see me in 4 weeks. We checked his sugars, fasting sugars. His sugar was like 130. And I'm like, that's good. He had started exercising. It's like he was so angry. Like and then he's like, doc, you got to take out that diagnosis. I said, well, we still got to give it another 2 months. Let's check your hemoglobin A1C again to see how you're doing. By the time he came back, he was no longer even pre-diabetic. He exercised. He really cut out soda, because he said, I want you to take that diagnosis off and I said, I'm with you. You got to give me the data. And so by the time he had come back, it was no longer, he said, okay, so can you remove it? I said, I can't remove it, but I can say, like, I can take out the chronic problem diabetes from your chart. So I took it out. So that was one. I had another one who, he was feeling a little depressed. I know, so he was eating to kind of self-soothe, to make himself feel better. And he stopped exercising, and so his cholesterol had gone up. I had to put him on cholesterol medicine. His blood pressure had gone up. He's like, doc, I want to try your way. Let's do this. He came back a few weeks later. He was feeling dizzy because he had been exercising so much and cut down on salt. The blood pressure medicines were working too well. So I took him off one. So he intensified, came back. He's like, doc, I'm still feeling dizzy. So I had to stop the blood pressure medicine. So I stopped it completely. And then he's like, cholesterol medicine. I said, wait. I said, let's half it. Let's see how you do. We did labs later. So we're currently waiting for the next labs, actually, before we decide that. He's like, doc, I want to be off. I said, remember, and I write it on a prescription pad, exercise at least 5 times a day for at least 30 minutes, includes 2 to 3 strength training sessions as medicine. And I give him the prescription. And so, when you see them get better and you're off the medicines, I'm like, remember, keep taking your medicine. Exercise is medicine. Keep doing it. It's empowering. It's empowering for them to see that. And I'll say this to Amanda, I love what you do. I love what you do. And I wish patients know this information, and that's why we're there. But sometimes the time constraint is there. But every opportunity is an opportunity to teach them, to tell our patients that these foods are good for you, and that they may not taste as exciting, but mind over matter, right? It's good for you, and then you do it.
Yeah. Yes. So that's so good that you have patients that are actually willing to accept that alternative and better treatment sometimes for their illnesses, because a lot of people, they do not want to take those medications. And I tell them, I was like, okay, which side effect are we going to choose from? Because they'll come back and tell you about the side effects of the medication, or they don't want that diagnosis. But like you said, they're trying to blame you. It's like, I didn't make these numbers up. Like this is what your body is telling me. And I'm just telling you back to what your body is saying. Right. So I love the way that you put that. So I think I picked up a few tips there from you that I'm going to actually say now back to a few clients and patients, tell them, no, I'm just telling you what your body is telling me. So what do you want to do about it? So I love that. If you could leave the audience with 1 or 2 tips about nutrition, what would you tell them and why?
So number 1, no one wants to be a nag, right? I want to just say, you got to do this, you got to do this. Tell you why. What do fruits and veggies do for you? What do plants do for you? They essentially help you fight off infection and help prevent cancer. They help with those processes in your body. Essentially, that's what they do. And so, number 1, they're good for you. They're preventive. So it should be part of your lifestyle because they're good for you. That's the why. And then number 2, I understand that eating is part of the joys of being alive. I'm a foodie. I mean, I enjoy eating. I understand that. But I also want you to know that there's a whole industry called food, like food engineering, which is engineered to make you fiend for it. Not because it's good for you, but because there's money to be made. I don't want you to play into that. I'm not saying don't enjoy them every so often, but there's a whole food engineering with high corn fructose syrup, with butter, with lard in it, because it tastes better, not because it's good for you, but to keep you feeling for it. So with those information, when you go out to eat, guard yourself and don't play it full. That's all.
Yeah.
Don't be fooled. No,
I
don't be fooled.
love that. Don't be fooled. Like there's someone there that just wants to keep you coming back for more of what they have, not because it's good for you. I tell people sometimes it may taste good on the taste buds, and that's just because, like you said, they engineered it to do that, not that it's actually healthy for you. So thank you so much. You already told us where you are located physically, but if someone wanted to actually reach out to you, maybe like via social media or anything like that, how could they, follow you or get in touch with you?
All right, so the practice has a website, www.living, so LIVING, spring, SPRING, medicals, MEDICALS.com. We're also Living Spring Medicals with an S on Facebook. And then on Instagram, you can find me at dr_Olabintan, OLABINTAN. You could reach out to me through any of those platforms.
All right. Thank you so much. And I will definitely put a link in the description. So if someone wants to touch base with you, that it's just a little easy click there. So thank you all for looking out today for our video, and we will talk with you soon. All right. Bye-bye.
Bye.